Hello everyone, welcome back to the NEET PGPYQ series. Here in this question, a 65-year-old postmenopausal woman with vertebral compression fracture, T-score is minus 2.7. So question here is which is the first line pharmacological treatment? Here option A teriparatide, option B biphosphonate, option D denosumab, option D calcitonin. So let's discuss about the option A teriparatide. So here teriparatide is a recombinant parathyroid analog, and the mechanism of action is stimulate osteoblast activity, which increase the bone fracture, increase bone formation. So and the indication here is severe osteoporosis. Indication. So T score, where T score is less than minus 3.5, T score, or multiple fragility fracture, intolerance to biphosphonate. So and option B is biphosphonate. Biphosphonate mechanism of action is inhibit osteoclast mediated bone resorptions, and the side effect of biphosphonate is esophagitis and jaw osteonecrosis, sometimes atypical femoral fracture also, but it's rare. And the example of biphosphonate is alendronate, risdronate, and zoledronic acid. So here it's a biphosphonate is a first line for postmenopausal osteoporosis. So here first line, it's a first line for postmenopausal osteoporosis. So here the correct answer is biphosphonate, because it's first line in osteoporosis. But let's discuss about the option C and D. Option C denosumab, it's used in postmenopausal osteoporosis, but especially in renal impairment or biphosphonate intolerance. So remember that use. And it's a denosumab, it's a monoclonal antibody against NKL, which is inhibit osteoclast formation. So here denosumab, it's not usually first line due to higher cost and risk of rebound fracture on discontinuation. So option C is also not correct. Option D calcitonin. Calcitonin is the hormone that directly inhibit osteoclast activity. And here the calcitonin indication is provide analgesia in acute vertebral fracture pain, sometimes used short term, and but efficacy is much weaker than biphosphonate or denosumab for long term fracture prevention. So it's not a first line drug. So here the option B biphosphonate is the correct answer, and that is also the first line treatment. Thank you.